the states and territories. I can't rule out that any state and territory may wish to put another issue on the table at some point in time, which they wish to negotiate, whether they want to negotiate that as part of a kind of multilateral agreement or whether they wish to deal directly with the Commonwealth. I just can't rule out that someone wouldn't make those representations.
Okay. So I suppose with the Northern Territory recording the nation's highest rates of stillbirth, congenital syphilis, rheumatic heart disease and preterm birth, what is being done, I suppose, at a federal level to adapt maternity models to these particular complex needs?
So Celia Street, Acting Deputy Secretary, Strategy and First Nations Group. There's a number of elements to your question there. So I think what I would say in terms of the models of care, we do provide support for birthing on country. As you're aware, we have a number of different models that we support that go to First Nations more broadly. In terms of model of care, specifically, say, in the NT, we haven't got a piece of specific work on that at this point in time.
Okay, I mean, I suppose with the proposed closure of the private maternity services, this will impact particularly across those areas. Has there been any consideration given to this impact going forward?
Yes, so we have been in conversations with the Northern Territory Government in terms of the impact of the closure of the Healthscope hospital, and unfortunately I don't have everyone here with me because that's under outcome to the private side of things. But we have been in conversations with the Northern Territory Government about supports that they may seek from government, but there hasn't been any outcomes from that at this stage.
Okay. So why did the government not intervene to sustain the private maternity services in Darwin when studies showed they were more cost effective and, I suppose, safer for patients?
So can I get you to repeat the question, because I don't think that we have something there in terms of the safety.
So, I mean, health is everybody's responsibility at a state, territory, federal level. I suppose I'm wanting to understand why the federal government has not intervened to sustain the private maternity services.
I think Helen would like to add something, and maybe Mr. Hawkins.
Senator, Professor Alice McMillan, Chief Nursing and Midwifery Officer. Senator, can I confirm, in referring to private maternity services providing particular outcomes, are you referring to the recent published study by Callender et al. that provided a perspective or a view that, in fact, private maternity did provide better outcomes than those of the public sector? Is that the basis of your questioning? Because it would be fair to say that there's been significant response in relation to that publication, and there is significant evidence that is contrary to that in relation to that study, and the belief that that study didn't appropriately adjust for a range of variables before it was published.
Well, no, I suppose my concerns are more to do with well, there was a report. There's a number of reports that I am referring to, which I can have emailed, but specifically we have, which is evidence, the highest rates of stillbirth, congenital syphilis, rheumatic heart disease and preterm birth, as well as the fact that this will now apply pressure to the system given the proposed closure of the private maternity services. And I suppose with that in mind, I'm trying to understand why the federal government hasn't intervened.
So I can perhaps... Ross?
Senator Ross Hawkins, First Assistant Secretary, House and Strategy Division. As Ms Street said, typically comes up under Outcome 2, so we've got our private hospital expert coming this afternoon, but I'll try and answer as much of your question as you can. So, very conscious that the facility they're referring to in Darwin is run by Healthscope. It's a private company, and it's their decision as to how and which and the services are provided within that private hospital. I haven't got the exact date here when they kind of spoke and told us that that was closing, but there's a level of engagement they had with the Northern Territory government, and then a level of conversation, I think it was kind of over a 3 or 4 month period, around what the transfer of those services back into the public would look like and what needs to be done between. And this includes elements of the workforce and the support mechanisms that would typically be in place as they close down their services, and that would be relocated into the public. And I think that's where kind of Ms Street was saying, and these are kind of further kind of conversations as part of kind of future hospital agreements around what the jurisdictions would want to do as part of that. But the closure of the private hospital was a decision for Healthscope that they made at that time.
So, well then, what then, if any, modelling has been conducted as to the knock-on effects of the closure, including paediatric services, litigation risks, and insurance costs, as clinicians have learned?
Senator, we'd probably need to take that on notice, largely because it would be an issue for the Northern Territory Government. So the Northern Territory Government provides the maternity services for the population up there, and they would have looked at what the impact of that would have been with the private work coming back in. So we can take on notice and engage with them on what that, if they've done any modelling, what that might look like.
I'd appreciate that. And how is the federal government addressing the fact that Northern Territory families are now being forced to travel interstate for their private maternity care, and often for a period of up to 12 weeks?
Yes, Senator, as I understand, and again, our expert is here this afternoon, I think there is still going to be levels of private offering within the public hospital, and that's been an issue that the government have been discussing with health insurers. But again, we might be able to provide a bit more detail on that for you later on this evening.
Yeah, I would appreciate that. While it's claimed that numbers fell from 700 births a year to fewer than 300 in the private system, does the department accept that this oversimplifies the issue, given the overwhelming complexity and national worst numbers for maternity outcomes, as I've previously mentioned, in the NT public system, that they have to negotiate?
Senator, there might be one for the kind of Chief Nursing Midwifery Officer to answer. I'm thinking kind of, because when you do get to certain levels of birth, and certainly we've seen this in the private system, we find that private operators feel it's no longer safe to offer a service, largely to keep the necessary staff with the expertise on hand. So that's where we've seen some closures across the country of maternity services historically, because the number of private births has dropped off. But it is an important factor that leads to the kind of delivery or effective delivery of a safe and efficient service. I'm not sure if...
So, yes, Senator, there is obviously a point at which very low numbers of obstetricians in this situation, or paediatricians, you may not be able to sustain a service going forward. What I do understand that has been put in place is that the Northern Territory Government has put in an interim arrangement with a midwifery-led model of care to support local communities with their birthing, so that where possible it can be supported within the public system, and that can be done supported by the public health system in the Northern Territory. So there has been changes made so that the use of private midwives can be sustained in the interim, while further consideration to service provision is made by the Northern Territory Government.
Senator Price, I'm just checking how much more time you need. My understanding was that Senator Blythe was going to share some of your coalition block of questions. So did you...
Well, I've got some questions that I can put on notice. Sure. Yeah, that's fine. Chair, can I just conclude on Senator Price's questions?
Yes, happy for you to do that. Yep.
As well, just in regards to a follow-on in relation to the assistance to the Northern Territory. The Northern Territory Government is set to receive over $550 million in terms of extra support in the Northern Territory for hospitals. So that's about a 30% increase, which is the largest it's ever received in 10 years. Yep. Is to receive that? That's right, in 25-26. So that's set to receive it. Thank you.
Thank you. Senator Blythe.
Thank you very much, Chair. Now, my questions are to the NHMRC, so we might need to play musical chairs again.